National Press Club to talk about SAMHSA's new wellness initiative on behalf of all the technical assistance centers. So we're here, and we're about to go into the press conference, and it's really exciting. It's really exciting to be here.
It's great working, actually, on the 10 by 10 campaign. You know, the data came out in 2006 that people labeled with serious mental illness in the public mental health system die, on average, 25 years younger than the general population. So that's pretty shocking data. Some of us knew it because it's our friends, our family members who are dying. But now they have this great campaign that says, basically, I mean, what I love about it is we're trying to change the culture. And to do that, we need to take big steps. And so as you know, we're part of this recovery month, which is September, and then we have National Wellness Week to turn around. Yeah, this is the first time we've ever had the National Wellness Week. Yeah. More focused on mental health issues and this particular issue. When I first started this job, I didn't really know much about what SAMHSA did, and I've been pleasantly surprised and encouraged to see all the positive steps that SAMHSA is taking towards recovery. The 10 by 10 campaign is just one of the things that they're doing, the many things that they're doing. Yeah. The 10 by 10 campaign is really about changing the culture. It's about focusing on wellness. And Peggy Swarbrick has developed these 8 dimensions of wellness that I imagine I don't know actually if people are talking about them in the press conference, but
I'm going to be talking about them.
Thank you so much for doing that, because these are universal dimensions. These are human dimensions. They're not dimensions for people labeled.
Yeah.
So it is very, and that's another thing exciting about wellness is I think it's very inclusive. It brings us together as a country, as a people, to focus on being well. Who doesn't want to be well?
Yeah, that's right. And people who have been through it, like us, we actually have a lot to teach because we've been to the depths and we've found a way to get control back over our lives. And so really we have a lot to teach to just anybody about wellness. So SAMHSA is really listening to our movement, and that's reflected in the concentration areas that the different TA centers have. And our 2 main concentration areas are crisis services and information technology, which have both been areas where our movement has said we want focus on these areas. And specifically with crisis services, we want alternatives to traditional hospitalization. And so a big part of what we do is we promote peer-run respite, and we provide tools for places to be able to start peer-run respites, and we connect older peer-run respites with newer ones in kind of a mentoring relationship. And there's other crisis alternatives that we promote as well, like warm lines. Peer-run respite is run by everybody who works there, from the director on down, has had lived experience being diagnosed and usually hospitalized, and so they've been there, and they've been through altered states and of different kinds, and so it's based on a peer support model. You're not, it's voluntary, there's no locked doors, you can go in and out as you please. It's really self-directed, and it's just had an amazing amount of success.
But one of the outcomes that I think is very impressive is that the cost of these peer-run respites are approximately 25% of the cost of a psychiatric hospitalization, even though people are at the same symptom level or they're qualified to be on a psych unit. They don't need to be. They can be in a peer-run crisis respite. And some other data I heard recently is that for some of them, I don't know if it's true of all of them, it may be, but that people who've been to some of the peer-run crisis respites, when they followed them, there's one study I'm thinking in particular, followed them for 2 years. In that 2-year time period, none of those folks went to a psychiatric hospital. In other words, they didn't need to be in a psych hospital, and I think it might have been part of the follow-up that they got.
Yeah, they're doing some great work on research in places like Nebraska, New York, and yeah, it's a great point. Another big part of what we do is as part of being a technical assistance center, we have a phone number that a toll-free number that people can call, 9 to 4 weekdays, and really talk about. Sometimes it's just for a little bit of peer support, and other times it's for referral to information. So it's providing access to information. That either we can point them to something that's on our website that's hopeful and encouraging, whether it's a book or a video, or we can point them somewhere else. And that's another way that we're able to support people, across the country, basically. And you can call from anywhere.
Exactly, and it's important because it's a message that they don't get anywhere else. I mean, generally, that kind of traditional messages, but also non-traditional, in different ways of approaching healing and recovery.
Yeah. Actually, one of the first places I called when I was going through when I had moved 3,000 miles away, didn't know anybody, was in graduate school in Massachusetts, and had a really difficult time, and ended up in a hospital, ended up losing touch with physical reality. When I got out of the hospital, the first place I literally called was the National Empowerment Center, because I found it, just searching around. And I talked to Lori Ahern, and she totally affirmed what I was going through. She said, yes, it's a temporary experience, there's hope for you, and I went through something similar, and it was a huge part of my recovery, just making that connection. I made more connections like that, and that was just huge for me. When you're talking with people, it doesn't matter where you are. When you have that shared experience, there's an immediate bond, and people, even if they haven't heard of recovery, if you talk about your own story and you share other people's stories, they immediately get a sense of hope. It's really quite amazing, and then it just creates a momentum, and then that's how these statewide organizations get formed. That's how they've been formed in the past, and that's how we're doing it now, is finding a few leaders, building leadership skills and whatnot within the group, doing some organizational development work, and then it really just takes off because it works. And I think the idea of it is that you have a presence now statewide to do advocacy, to do events, to run support groups, whatever it is that the organization would like to do.
Mm-hmm. I wanted to go back for just a moment, because you were talking about, like meeting other people that have been through similar experiences, and for me, and I think for, just probably tens of thousands, if not more than that, that is so key. And I think people that haven't been involved in the system probably don't understand that, what it's like to be so isolated, and think it's your problem, It's like your diagnosis and your problem, and you just need to work hard and fix it and not bother people about it too much, what I mean? You have your treatment team, if you will, and maybe some supporters, but it's very isolating. And so part of, what SAMHSA funds, is that, like you're talking about, to organize on the statewide level, but it's just that message that of hope that I think the TA centers bring and the statewide consumer networks bring, is that you're not alone. For people who've never heard that recovery is possible, and that's huge.
Yeah, it is huge, because healing happens in communities with other people, and so I think SAMHSA is helping to break us out of the silo in a way.
And they're the only federal department, really, that is doing this work. I mean, it's the only federal sustained money outside of Medicaid that comes to people with a lived experience of mental health recovery.
Yeah.